Hi, everyone.
Oh, hi, Megan.
How's everybody doing this morning? This is actually Jen Sarah. Megan has me logged in as her. She said I can play her for the rest of the day. So it's an honor and a privilege to play Megan. We have, is it Dr. Yannick with us today? And then we have Dr. McGee.
Hi, Jen.
Hi. And then we have Paul DeWise. Is that correct?
Yes.
And we are going to be talking about COVID and the impacts with donation. First and foremost, I want to ask the doctors, so Dr. McGee and Dr. Yannick, what has changed procedure-wise for you all because of COVID?
John, I'll let you go first.
Okay, thanks, Greg. Well, welcome everybody. I think some of the things that have changed really have been trying to figure out what the disease was about. Again, as you guys, everyone on the call knows, in February or March, we had no idea really what would happen, what the future would hold, how bad it would be, whether patients that get transplant would be disproportionately affected or other components. One thing we've done a lot of is actually stress the importance of hand washing, wearing a mask. As the pandemic has grown, important to be physically isolated from large groups of people. Another big thing that we did was we transitioned a large amount of our care to virtual. So we have done phone calls, e-visits, virtual care visits that have made both. It's created an opportunity to get in touch with patients more frequently and without having people to drive. We still see people in person, but the clinic shift has been a big component of it. With respect to transplants, we started testing all the donors and recipients when they came in, which created a huge logistic challenge. Kind of the act of going out to get a donor was also challenging because we also often interact with other teams and go to other hospitals. And then kind of the final challenge was getting, there are a lot of there are donor hospitals that need to be up to speed. All the various transplant centers need to be up to speed. The organ procurement agencies, such as Gift of Life Michigan, need to figure out what they're doing. And then finally, the Red Cross had big challenges as far as making sure we had enough blood supply. So a lot of things changed. We've learned a lot and we've adapted, and now things are pretty much business as usual. But we've taken away the good lessons we've learned, such as virtual care visits. Jen?
Sorry, I just realized that I was muted during that. I just asked Dr. Yannick to give us his perspective on what's happening on his end of the woods.
Sure. So I'm Greg Yannick, the director for the Pediatric Bone Marrow Transplant Unit at Mott. So I look at it in terms of three levels. One, what was the impact on our patients? Two, what was the impact on our medical care team? And three, what was the impact on our donors for bone marrow transplants? The impact on our patients was tremendous. I think of a patient in May, a young man who on the day before his transplant, we made it mandatory that all patients coming into transplant must have COVID testing. This young man, the day before his transplant, his COVID test came out positive. And then it became a decision of how long do we delay his transplant. Patients who are COVID positive can sometimes remain COVID positive for 2 months, 3 months even though they're no longer contagious per se. What do we do with this disease in the interim? So we were faced with these challenges. Ultimately, we brought the young man in after a 3-week period of him being asymptomatic. And then it became, what do we do with our positive pressure rooms? If he's still COVID positive, he's on a bone marrow transplant unit. All of our transplant patients are in positive pressure. How do we handle that? Should we put him in a negative pressure room, which is reverse airflow? So air is coming in instead of coming out from the room, which is what we did. So for individual patients, things were incredibly difficult. Visitation policies changed. I'm on a pediatric unit. The hospital policy was no visitors. We allowed one parent to stay for 7 days straight without switching off with another parent or caregiver. We delayed multiple transplants and CAR T and cell therapies during this period. And then we faced the biggest issue that I hadn't even contemplated when this all started in March, April, and May is the level of transfusional support that we had. Blood donations through the Red Cross went down dramatically. To go through a bone marrow transplant needs a ton of red blood cells and platelets. And all of a sudden we had a blood shortage going on just because it was very difficult for people to donate during the peak of the pandemic. So from our patient standpoint, there was multiple logistics and delays in transplants, visitation policies, getting enough transfusional support. From our medical care team, we had bed shortages. We consolidated 2 transplant units into one so that we could create a RICU up at Mott Hospital. RICU is our respiratory isolation care unit. And we paired our teams into 3 groups, A, B, and C. So that way only one could get infected at a time on the unit. So team A would round, followed by, for a week, followed by team B, followed by team C. We actually did virtual rounding, both inpatient and outpatient, amazingly, during this period. And then was the impact on our donors. We couldn't take the risk that our donors could all of a sudden be positive for COVID on the day of collection. So what we did was we actually mandated that all of our donors donate prior to the bone marrow transplant even starting, which changed the donor schedule. If a transplant was due to start, let's say on a Friday, that collection had to be done before that transplant even started. We couldn't take the chance that a transplant would be ready to go and all of a sudden the donor is COVID positive. So it had a tremendous impact on us, both our medical care, on our patients, on our medical team, how we organize things, and even on our donors.
Thank you for sharing those stories and how this has impacted you all. Paul, can you talk a little bit about how COVID has impacted your transplant journey? Because you have a little bit of a unique story.
Sure. Can you hear me okay? Can you hear me?
Yes.
Okay, good. Okay. Yeah, my name is Paul DeWise. I was diagnosed with alpha-1 antitrypsin deficiency 22 years ago. I suffered with bad lungs for a long time. In 2018, I was able to get a double lung transplant. And my lungs are just great. I have very strong lungs. I went from 15% FEV1s to I'm at about 110% right now, which is pretty amazing. So I can run around, I can do flips, I can do all kinds of fun stuff now. So being diagnosed with COVID as a transplant was very interesting. And since I was the very first patient in Michigan to be diagnosed and U of M's very first patient, the treatment was, I would have to say, very specialized, and I felt like I was probably the only person in the hospital. I mean, I had so many doctors coming in and out, so many nurses. Generally being a transplant, I forgot to mention, I'm about 2.5 years out of my transplant, but just being a transplant person, when you go to the hospital, I went in because I had flu symptoms and I just thought I had the flu. And whenever you go into the emergency room as a transplant, they take it pretty seriously and they take care of you right away. So you already get, very customized, very close, people watching over you as a transplant. But I felt with COVID, holy cow, it was just amazing. And they were being very, very aggressive with me. So they had me on 3 types of intravenous antibiotics at once. I did hydroxychloroquine. I'm not sure how you pronounce that, but so I did that. And, I had like 3 or 4 nurses in my room at a time. It was just, so U of M did a great job. It seemed like everything they were doing was kind of, to some degree, it was trial and error because I was their very first patient. And when I asked them questions about things, they didn't even know. So, I mean, it was a kind of a learning experience. So it was very different, but very good, and very happy to be at U of M with it.
Yeah, COVID has definitely been a learning experience for all of us. How has this affected your mental health as a transplant recipient, as doctors, and your teams? Because this is a very difficult time, and it's been going on for what, 7-8 months now. So it's a very long period of time. So how has it affected your mental health, and how are you and your team teams or you and your family coping?
I can go first very briefly. This is Paul DeWise again. And, you know, I definitely went on anxiety medicine, and I'm not afraid to say that because it was, you know, after double lung transplant, I also had an ileostomy done like 6 months after my transplant. So I had all kinds of, you know, I mean, I had some health issues, but I was feeling pretty darn good. And then when COVID hit, it was like, oh my gosh, you got to be kidding me. I mean, I seriously thought I was going to die because that's all I had heard on the news was everybody in China that was dying was the people that were dying had compromised immune systems. And of course, I had a compromised immune system. I was in isolation. No people could come in, you know, and be with me or anything. And so it was just really rough on me. I mean, just being in the hospital for 11 days, you know, all by myself, thinking I was going to die. It was terrible. So, you know, I mean, it took a big toll on me, and I'm still on, you know, a low dose of anxiety medicine, but, you know, that's kind of how it affected me. I'm doing pretty darn good now. I mean, I don't have any issues, but it's rough going through it. There's no doubt.
Well, thank you for sharing that, Paul. I think it's important for people to hear stories like yours. So more people know it's okay to take anxiety medications.
It is. I mean, that's traumatic, you know, so.
Yeah.
One of our patients had a sign in the room that, you know, it's an old saying, many people have heard it. You only know how strong you are when being strong is the only choice you have. And the sign hung in one of our patients' rooms. It truly is a testimony to what our patients' families and our caregivers have gone through for the resiliency that they've been able to show over the last 6 to 8 months during this pandemic. It really has become a band of brothers, not only between the patients, the nursing staff, the physician teams, but I would truly say that it's just been a heartwarming and encouraging to me to see how everybody has teamed up together, realizing the limitations we have, even including things like the visitation policy I discussed, just to make kids feel special. I mean, shoot, I can't tell you how many kids have birthdays in the hospital undergoing transplant, where the only person that could be there with them is one person. And we did amazing things to really show our patients that we cared about them and the care we are giving them during this pandemic so far. So
I think for the solid organ transplant programs, our story is very similar to what Dr. Yannick mentioned. I think the impact on the patients was one thing that affected all of our mental health, because that's obviously first and foremost among many things we do. The uncertainty of what everyone was facing was a challenge. We ended up having to cancel transplants. We knew less what we were doing at any given minute than any moment before. I think the stress of the visitor policy on the patients, while meant to keep people safe, was really something that I think had a big impact. The whole system really upended the healthcare machine. You know, transplants only really part of it. So we function in a system that has many operating rooms, emergency rooms, health, you know, ICUs, floor units, and all of them were adapting as well. Several of us were also potentially challenged with having to cover COVID patients during the influx of early in March and April. I think everyone has, you know, been impacted by our families as well. The uncertainty, the school, kind of the challenge our staff and faculty have now had to with virtual schooling. It's been a challenge. I do think we managed to learn a lot from, you know, Detroit and Southeast Michigan was among the first places really hit. And I think the rest of the country thought it was only going to be us in New York, and it turned out not to be true. But we learned a lot from New York's experience, and we were well prepared. And I think we're more prepared now if there's really a second or a third major wave. And then I think one of your questions, Jen, was about just the team staying connected. A lot of the teams are now working from home and virtually. So when I go up to the offices in the transplant center, sometimes it's only 1 or 2 people. I was walking by one of the rooms the other day and actually heard noise coming out of it, which was a great thing. One of the things we do, you know, we're in this to be connected to people, and so that's been a challenge. So I think just like the patients and their families have been impacted, I think all the healthcare givers have been impacted as well. And as Greg said too, you never really know how strong you are until you have to be strong. But it's been a challenge, but it's been a great team to work with.
Yeah, I definitely agree with that quote that Dr. Yannick had shared, because it really is amazing how strong we all are when we have no idea until we have to be. Next, let's talk a little bit about long-term. We've heard that, and I know a lot of these things are still being researched because COVID is a novel virus, and there's a lot of peer reviews and things that still need to be done, but we've heard that there's some long-term consequences from having COVID. So Dr. McGee, can you talk a little bit about those long-term consequences? If these survivors are having some problems and may need organ transplants later, and if that's adding to the wait list.
Certainly. So as you said, I don't think any of us envisioned that there would actually be the need for transplant after the patients recovered from this. But the two most commonly affected organs are really the lung and the kidney, it looks like, in the realm that would need transplantation. Most infections are inflammatory and they usually go away and your body resolves the issue. It's clear that in some patients, the inflammation from the COVID virus and that your body dealing it with is going to cause long-term fibrosis. There has been a report of, the first report was in China of a person who got a lung transplant after COVID. In the United States, there's been one person I know at least listed and I believe was transplanted. And there's probably going to be more. I think the key will really be making sure people recover. Whenever a patient has a disease that needs transplant, our first hope is always that they'll recover enough that they won't need transplant. So I think it will take a year or two to really figure out how many people go on to lung scarring bad enough to need a transplant. It's clear there'll be several people that will have lung impact that won't need transplant, but will impact their quality of life and their overall function. So good reason not to get it, among others, is that the long-term sequelae. With respect to kidney disease, the kidneys can also get shut down in people, and I suspect we'll see some patients that get kidney transplants related to COVID as well once they recover. But right now, it's not impacting the wait list at all, but it'll be hard to tell exactly how many people will be affected bad enough to need a transplant.
Thank you for speaking to that. It's all very new for us, and we know that things are changing every day.
As you said, that's kind of a guess. We've been making guesses, since February, and somebody said that the easiest, all the decisions we've been challenged with that have seemed really, really hard, about 2 weeks later, it becomes very clear what the right answer was. So, but that's our best assessment of the situation at the moment.
Yeah, John.
Well, and luckily what you guys all did with Paul worked out really well. But Paul, have you had any long-term effects after your initial recovery?
No, it's been, 7-8 months now, and I kind of am one of the lucky ones so far as I can tell, but who knows what's coming. But I am in a couple studies that, I'm working with some people at U of M to be in studies to, track my wellness as we go along to see if anything does change or anything. I did have the antibodies for the first 6 months, and now I was tested recently and I no longer have them. So that's a big question for me, which nobody can, really tell for sure if you're still immune or not. And I take it that I'm not, so I'm being very, very safe. So not at this point, no long-term effects.
Well, that's wonderful to hear. Dr. Yannick, I was wondering, I've heard that a lot of people that are about to get bone marrow have to travel, or actually the donors have to travel to help complete the donation. There's a lot of, anxiety around traveling right now. Are there travel precautions for these donors? How is that all being handled?
The travel needs aren't exactly, you have to split them into two categories. If the donor is a family member, a sibling donor, for example, then it's just a matter of coming from wherever their home is to the hospital. Typically, the family at U of M already has some setup for living arrangements, so that one isn't as big an issue. Bigger issue is if we have unrelated donors that are donating through the National Marrow Donor Registry and they're coming from several hours away. There is the same thing. We have to plan these unrelated donor collections well in advance with careful thought for how are we going to get the donor down, where are we going to put the donor up if needed, when are we even going to do the collection, what's the timing of that with the transplant. It is a multidisciplinary effort to do bone marrow transplants in this COVID era. And one of the big efforts is our social workers' efforts. Our social workers have to be very cognizant of these issues. So yes, fortunately for us, most donors are within an hour, so they can typically come in and get back at the same, on the same day. But we do run into longer travel situations. So.
And one more question for you, Dr. Yannick. I just lost my train of thought. I hate when that happens. I think I was going to ask you about the travel. And, oh, I know what I was going to ask. Sorry about that. I had a little mind glitch. How are we making sure that recipients don't get COVID from their donor, whether that be from bone marrow or from organ transplant?
Yes, certainly the one thing we do is that all donors undergo COVID testing prior to their donation. And we pretty much put our donors on lockdown for 2 to 3 weeks going into their donation. So they're already basically quarantined coming into their donation. And then we do COVID testing on them within 2 to 3 days of the collection itself. So that's the best thing that we can do in terms of safeguarding our marrow recipients from anything that they can get from the donor. But I will admit this, there really hasn't been any documented transmission yet of COVID from a marrow or cell therapy product to patients. At this point, we still view it as a primarily respiratory spread disease through viral droplets. We have not seen any blood transmission that we can document of COVID from a donor to a patient. Have there been any donor products that have tested positive for COVID? To my knowledge, there's been anecdotally a couple, but again, we haven't seen any communicability of that with the marrow recipient so far. So.
When you mentioned Dr. Yannick, I'm sorry, Dr. McGee, I just have one follow-up question. Dr. Yannick, you mentioned how the spread is more through aerosols and droplets and things like that. When I signed up for Beat the Match, I know they did like a spit swab. Are they doing that now, or are they putting that on pause? How are they handling that situation?
That's a great question. Back in the spring, they had switched just to doing blood sample collections for doing the tissue typing required for the National Marrow Registry. Now they've opened it back up again, and now they're back to doing buccal swabs. I have a feeling it's kind of like what John said. I love John's line. We knew less of what we were doing on any given day than we know less of what we're doing on any given day than we did the day before, meaning I have a feeling this all changes. Meaning back in the spring, we stopped doing buccal swabs and we went to blood collections. Now we're going back to buccal swabs. I have a feeling that with the second surge coming on, we may be going back to just doing blood sample collections for doing our tissue typing. At this point in time, November 1st, though, we are doing buccal swabs. But I have a feeling as this pandemic, as this surge picks back up, we may be going back to
Thank you. Dr. McGee, how about you for this area?
I think for donors, there was a lot of worry about being able to test the donors, make sure they didn't have it. Some of that is obviously the primary goal there is really the donor safety, but the teams going out, it's a big deal if you're doing bronchoscopy or in close contact with a patient that has it. The donor teams also need to be safe. It turns out that the virus is not really spread by the blood. There are some report cases where it can be in the blood, but those are patients that are very, very, very sick and they wouldn't be donating. So their kidney and liver would already be sick. So there's been no documented transmission. I think the biggest challenge though is lung transplants, where obviously the lung, it could be the harbinger of it, but we haven't seen any confirmed transmissions in the blood of non-lung patients in the United States. And we screen people, both the donors and the recipients, ahead of time. But the good news, this isn't quite like West Nile virus or rabies that are really, really a problem from blood transmission.
I do have to give a special kudo to the National Marrow Donor Program for what they did this spring. One of the reasons that we switched from buccal swabs to getting blood sample testing this spring at the beginning of the pandemic was that the National Marrow Donor Program literally just donated all of their buccal swab tests for using for centers to allow to use for COVID testing. Basically, they gave up well over 100,000 test kits that we were using for buccal swabs that could be converted to COVID test kits. So they literally downsized their ability to do buccal swab testing, which is, I thought, pretty noble for the National Marrow Donor Program to do.
Yeah, I agree. That was very noble of them, because I know there was a shortage of those. Testing was a huge problem earlier in the pandemic, for sure. I think it's starting to get better. Well, and then there was also the question of the accuracy of the tests from a lot of sources as well, which I imagine would also impact the donation process. With our last 3 minutes or so, I was wondering if we can end today with what precautions you guys would recommend to transplant patients, and from Paul's side, what you would recommend to transplant patients as precautions as well, and just basically how you coped. Anyone can go first.
Okay, I'm sorry, I couldn't get off my mute. I'll go ahead. My best advice to to other transplants is, besides all the obvious, wear a mask, don't put yourself at unnecessary risk. I mean, there's no reason to probably get on an airplane right now. Don't go to large parties and group gatherings, everything that they're telling you not to do. Listen to the scientific doctors, listen to your own doctor. One thing that has really helped me along in my whole, my situation with my lung transplant and my other health issues that I've had, is taking control of my own doctoring, kind of, take control of your health and know exactly all these, I go in and get my breathing test done. I know what every single number means. People need to really take control and understand what they're doing, because the doctors are great and amazing, but sometimes, they don't know your body as well as you do. And, the thing with lung transplant, from what I understand, is symptoms from different things, they lag behind what normal people have. So, I might have a really bad cold or a really bad lung infection. It doesn't show up because of all the meds I'm on for, maybe a week. So if you know one little thing that's wrong with your body or something, go and get it taken care of. Keep in touch with your, doctors. And, another great thing I think has helped me tremendously is exercise, stay healthy, and eat good. I mean, that really does matter. So that's my advice.
Thank you, Dr. McGee. Dr. Yannick, do you want to go next, or would Paul like to go next?
Yeah.
Oh, that was Paul.
It was Paul.
Yeah, that was me.
He never speaks eloquently to the patient perspective as Paul does.
That's right. Just in general, I agree. Just in general, the severity of any infection that you get in life, whether it's COVID or anything, depends on three things: the size of the amount of the inoculum that you get, the amount of inoculum. Do you get 10 viral particles or 10 million with the initial insult? The immunocompetency of the host, and then the virulence or the strength of that pathogen that you're getting affected with. Well, we can't affect the virulency of COVID. It's already predetermined. We can affect the immunocompetency of our hosts. Our patients going through transplant, they're immune suppressed. But what we can affect is the size of the inoculum. So for our patients, I have them on strip lockdown, and I smiled with what Paul said. Our patients are not flying. Our patients are wearing masks. A lot of our patients are double masking. They're wearing goggles and face shields. Anything they can do to, if they come in contact with the virus, to cut down the size of that inoculum. Early treatment interventions are typically or definitely better than waiting until patients have moderate to severe disease. So cut down the size of the inoculum any way you can.
Yeah, I think at the end, as everyone has pointed out, this is an infectious disease. We know how to deal with it. The same principles that have applied for centuries are there. So as Paul said, just do the common sense things, and that will make a big difference. I do think it is noteworthy that with this event, blood drive is a big part of it. The pandemic has clearly impacted all phases of transplantation and healthcare, but one of the unanticipated things as we were starting to gear back up for transplants is we were in danger of potentially canceling some because there wasn't enough blood at the blood banks. And I didn't anticipate this, but it turns out a lot of blood drives are done by companies and in large gatherings, which of course couldn't happen. So the Red Cross has done an amazing job maintaining the blood supply, but it's a challenge. Bear with them, donate blood. It really is perhaps the biggest uncommented part of this has really been the impact on the blood supply.
And Paul, before we go close with your final perspective, I just noticed that Cassandra had asked a good question in the chat. And I'm sorry, Cassandra, that I didn't see it till just now. But you had asked if COVID can be contracted through the eyes. And it looks like Dr. McGee had gotten back to you that we don't quite know. I think I read some research that would say that that's a mucous membrane and there's a possibility, and I believe that's why the healthcare workers are wearing face shields. But like Dr. McGee said, these things are all being tested. I have a shirt that says, what do we want? Evidence-based science. When do we want it? After peer review. Well, we don't have the capability to wait for peer review right now. So I think we're all learning more and more each day. Paul, can you close us out today with your experience and what you'd recommend to recipients?
Oh, sure. Well, I don't think you realized that was me earlier talking. I don't know if you knew that or not. I kind of gave, what's that?
I just said, I'm sorry.
Oh, that's okay. That's okay. But I mean, I gave all the advice about, just do the normal things and, be safe, eat well, exercise. If you feel anything coming on, let your doctors know, talk to your doctors, use your support group. Mainly like both doctors have said, whatever you can do to cut it off ahead of time is huge. We all know that mask and everything works. So, that's all I can say is in this time period, we have to be as safe as we can and, don't be risky. That's my bottom line.
Indeed. Well, thank you all for coming in today, or well, actually not coming in, I should say, for tuning in today to share your knowledge and experience and to share your story. We really appreciate you guys doing that because there's a lot that we don't know still, and it's always good to hear the experiences, how things are being impacted as well. Would like to encourage everybody to join the Organ Donor Registry, and to do that, you can go to golm.org/go/WFL, and we'd also like you to join the Bone Marrow Registry, and that is at join.bethematch.org/GoBlue2020. Thank you all for tuning in. We will have some more panels coming up later this afternoon, and stay safe.
Thanks so much.
Thanks, everybody.